Hello guys, welcome back to my YouTube channel. I am Dr. Nazo. Here we talk about everything lifestyle, health and entertainment. And today we're going to be tackling the entertainment portion of this YouTube channel. I'm going to be reacting to a Nigerian medical series on Netflix that I stumbled on. The name of this series is Heart and Soul. So before I start, I'm going to read out the disclaimer that was put out by the producers. Just give me a second. And they said, this series was produced as a work of fiction where processes have been adapted for dramatic effect with no guarantees of completeness, accuracy, usefulness, or timeliness. The opinions expressed in this episode do not represent the views or medical doctors or indeed any hospital. These guys decided to save their asses just because if they didn't put this disclaimer, we as medical doctors or healthcare professionals would have actually come after them. So that being said, this video is just solely for the purposes of education and entertainment. So guys, let's crack on. Okay, so we're starting with season 1, episode 1. Here in episode 1, we've got a lady who is in labor apparently, and okay, let's see what the nurse is about to do. Maybe a vaginal examination. Wait, I don't understand. She didn't do a vaginal examination at all. No, reached without a vaginal examination, without anything, like without even a scan. Please help me. Like, how did she know? Is she performing magic? Help me understand. She just bent the lady's knees and said the baby is built. But then again, it's possible. You can see the leg, the baby's leg dangling out of the vagina. It's not, you know, like it's not uncommon. Let's just continue.
You see, at this stage, the baby don't suppose stay upside down, ready to come out with the head. But this one, sit down gently.
Yeah, that's true. I'm just going to define what breech presentation is, which is when the fetus presents with the buttocks or with the feet instead of the head, which is the common presentation. By this time, especially when this patient is in labor already, the baby is supposed to have turned with the head first, ready to come out from the canal. So let's just continue.
They try come out with leg first. It's not normal. But we go try give them time to see whether the oga or mother already inside there. They try change his mind, come turn around.
Okay, so like the baby is just going to magically somersault and bring the head out. Now the patient is in labor. Now, supposedly this lady must have been going for antenatal checks, and usually during this period there are some scans that would have been done that would have detected that this baby's head is presenting first. Usually if it's before 36 weeks, the baby tends to turn by themselves. Probably at 36 weeks, obstetrician may have had an assessment and figure out if the baby had turned, and if the baby hasn't turned, they'll probably agree on what to do next. Maybe try to turn the baby by themselves manually. After 37 weeks, the chances of this baby turning is slim to none. This lady actually looks, you see how she's sweating, like she looks distressed. I don't even know the situation or the condition of the fetus at the moment. There are some breech presentations that have actually been delivered. They're usually done by skilled obstetrician and also in a skilled healthcare setting. But there are contraindications to delivering a breech presentation. It's up to the obstetrician's assessment to determine if it's safe to go for vaginal birth or to go for a CS. Now her blood pressure is rising.
Early stage of preeclampsia.
So this nurse has said that this lady is at early stage of preeclampsia, and I'm just trying to figure out how she knew that this lady has preeclampsia. Please, high blood pressure does not necessarily mean preeclampsia. You have to figure out if she has the symptoms. You have to also do some blood tests, do some urine tests, and you make the diagnosis with what you get, not just a rise in blood pressure. So So let's say this lady has preeclampsia, is already a contraindication to vaginal birth of a baby with breech presentation. Let's continue.
That doesn't sound funny. What does that mean?
That doesn't sound funny. This is supposed to sound funny now. Jesus. Yeah. Wait. What she? Oh Lord. Oh my God. It's like she didn't just do that. What's trying to achieve with this? She said let her check the baby and she got her stethoscope to listen to what exactly? Bowel sounds. Please. The basic instrument or equipment, the basic equipment that you need to listen to a fetal heart sound, a fetal heartbeat, is the fetoscope. The fetoscope is everywhere in Nigeria. You don't even need a stethoscope to listen to the fetal heartbeat. Seriously. This is not doing anything. So I don't understand what she's trying to achieve with using the stethoscope. Okay, let's just continue.
Yes.
Yeah. Cesarean section is actually the better option in this scenario, given that her blood pressure is high and there's a possible preeclampsia. Then
I don't want an operation. I don't want it. I want my baby the same way my mother had me. I don't care how long.
Now, this is one thing I'd want to talk about. I want to talk about it just because we've seen a lot of cases like this. I've seen a lot of cases like this when I was in Nigeria, where women refuse CS and say that they want to give birth the way that their mom gave birth to them, or that they want to give birth like Hebrew women. Are you a Hebrew woman? You see someone that is deteriorating, or the woman is deteriorating, the baby is deteriorating, and she says she still wants to push. Like, how is that going to help your life right now? It has to do with societal influences anyway. The society look down on people that actually deliver via cesarean section, like as if it's a bad thing. That being said, it's important as females to be able to make informed decisions with respect to how we want to deliver our children and to deliver our babies. So I'm not for giving birth as a Hebrew woman when you're about to die. Please now, use your sense. If you die in the process, the man will go and marry somebody else. Stay there doing Hebrew woman. You're not just doing it for yourself, you have to think of the baby also. So I guess they actually decided to go for the CS, and that's fine. Let's fast forward to what now happened after the CS, because this lady supposedly has preeclampsia, and with preeclampsia you're supposed to, after the delivery, you're supposed to still keep a close eye and keep monitoring the patient, just because they can deteriorate very quickly. So this lady she really looked in this. I was like, this is a typical African family. They came in the room, they're celebrating, and yes, this nurse actually came in to check blood pressure, I think, to also check on the patient to see that she's doing well. And then suddenly she just started seizing. Now she's got seizures. This is what we call eclampsia. It's actually a complication of preeclampsia if preeclampsia is not managed. Not really if it's not managed properly. It's just something to keep an eye out for, because usually people with preeclampsia can just go straight to eclampsia or have any complications from the preeclampsia, and this is one of it, the seizures that she's having. So I'm just going to talk about seizures in general, what people also know as convulsions. Now, if someone is seizing like this, or someone is having convulsions just right in front of you and you're a bystander, what do you think the next thing is to do? Because the next thing is not to come and start pouring water on the person, or come and start screaming, hey Chimo, hey. It does not help. What it should do is actually to turn the patient to the left position, what we call semi-prone position, so that the saliva does not go into the lungs, which is also a complication of seizure. Now, when someone is seizing or convulsing, we don't usually go immediately and start giving them medications. We have to wait, because most times the seizures stop on its own. Within 1 minute, 2 minutes will just stop. But if it stays up to 5 minutes, that's when we as healthcare professionals give medications, anti-seizure medications. But in the meantime, these are the things that you can do. Make sure everywhere is safe first. Turn patient to the left position. Do not crowd and be watching as if you have not seen someone convulsing before. Just clear the area and call for help. If you're in the hospital, usually we give oxygen in the process, or IV fluids or something like that. Some people give IV fluids, some people give oxygen whilst the person is seizing. If after 5 minutes the person is still seizing, we give medications. please do not give spoon. Kukuma kill the person now. Your herbalist now, you're putting spoon, you're pouring water up someone that is seasoned. Let's just continue. So they've called the doctor. Patient is still seasoned. I'm sure by now it has passed five minutes. But patient is still seasoned. These people are not going to kill me. They're not going to kill me. Please. I was like, seriously, what's happening here? Okay, now this patient season and goes into cardiac arrest, which is supposedly what may have happened here. He didn't check the pulse to see if the patient is actually in cardiac arrest. Let's say the patient is in cardiac arrest and he started chest compression, CPR. I still don't understand what he was doing. Like, it was like this. But then again, it's a movie. You're not going to start pouncing on patients the actress's chest before you crack a rib saying that you're acting movie. But it's just to let you know, so you don't think that is the way, because that CPR is actually very ineffective. So let's continue. And what is a Nigerian movie without the ghost scene? The spirit has actually apparently left her body whilst they are giving ineffective CPR. Let me say something. They're doing CPR. That's the basic CPR, basic life support. That is what is happening right now. Now this is a hospital setting. In a hospital setting, by now they would have gotten the crash trolley, which has the AED, the defibrillator, what they're going to use to actually resuscitate this patient. The basic life support is what every bystander, every person is supposed to know how to do whilst they're waiting for the paramedics or the people with the actual defibrillator. I can't see anyone going to bring defibrillator. In short, the other doctor came to check the eyes to see if the pupil has dilated, see if the lady has died. Let them call it. If that's how we do CPR in real life, that means everybody will be dying now. It's a movie, it's a series. Don't take it too seriously. This is just for entertainment purposes, and at the same time I'm trying to teach you and let you know the right thing so that you don't judge from this, okay? You know what, the lady's grandmother in the spirit world chased her back to life. Oh god. And that was how the lady came back to life, my dear. It's not from the chest compression. No. It's not the chest compressions that saved this lady. It's her grandmother in the spirit world that saved her. So that brings us to the end of episode 1. If you like this video, let me know in the comment section if you want me to continue reacting to this particular series. And also remember to give this video a thumbs up and subscribe to my channel. Thank you very much for staying tuned. I hope you enjoyed the video. Bye.